This research is titled Interprofessional Dynamics Are Crucial to Leveraging Nursing Professional Dignity, Perspectives from Palliative Care and Community Settings. And this has been a research that is embedded in a thread of studies, and these studies are focusing on this new concept, the concept of nursing professional dignity. That you know, it's a concept that began to be studied in the early 2000s by our research group, and it was studied in different parts of Europe and also in some parts of the world, in some regions of the world. So with this particular study, we focused on this concept, nursing professional dignity, from a particular perspective, and from palliative care. And please, next slide. So the concept of dignity is a concept that it's ingrained in the philosophical, theoretical, underpinning of many disciplines, and especially of disciplines linked to ethics, linked to philosophy. And this concept, dignity, has been studied massively along the years. Over the years, there is a long story about the concept of dignity. And out of the studies that have been conducted on this theoretical construct, dignity, that is an overarching concept, and this concept can include also other ethical values, can be divided, dignity, into two main attributes. So the first attribute is absolute dignity, that calls for recognition of an inner worth of persons, and the other big concept embedded in dignity, in the bigger concept of dignity, is social dignity, that can be changeable and can be lost as a result of different social factors and moral behaviors. In this light, the nursing profession has a professional dignity that has to be recognized all the time, because many studies have noticed that when a nurse, and we are concentrating our discourse on nurses, but also other health professionals, when they are losing their dignity, especially during their work, these health professionals, the job satisfaction is decreasing, and there are bigger problems for patients who are the recipients of care, and should be prominent for all nurses and all health professionals, but also for ourselves as health professionals. So it's generally accepted that there is a direct and critical relationship between nursing work environments, and dignity, constituting the social part of dignity. An ethical work environment is defined by the respect of human dignity in the interprofessional relationships with all health professionals in clinical workplaces. And and the literature is very fussy about this. If the interprofessional relationships in a particular setting where nurses are acting, their assistance, their care is pivotal, to have good care. And please, we can go on. So the aim of this research was to describe and evaluate nurses' perception and experiences of professional dignity in a particular setting, in the setting of palliative care. Please, next one. The purpose of this qualitative study was to analyze nurses' professional dignity in their everyday working lives, in hospices and on care. We explored the factors that affect nursing professional dignities in practice and that emerge in relationships with other health professionals. Please, next slide. The target group consisted of a purposive convenience non-probability sampling of clinical nurses working in palliative care centers, in hospices and on care, in 2 Italian regions, and these regions were located, one in the northern part of Italy, was the Piedmont region, and the other one in the central part of Italy, and it was the Lazio region. In total, we led 12 focus groups, and 69 nurses were involved in these interviews with focus groups. The initial pilot focus group question asked participants to point out some indicators of nursing's professional dignity and underpin the main elements that constitute and compose this construct in that particular setting. In our study in palliative care. Please, next one. Which were the inclusion and exclusion criteria for the sample? The inclusion criteria for participation to the study were to be a clinical registered nurse and working in palliative care for more than 1 year on a stable basis. And the exclusion criteria were to have managerial roles in palliative care environments. Please, next one. The data were transcribed according to codes that were reduced in 49 subcategories and 17 main categories. 5 connecting themes were found, and these categories reflected the perceptions about nursing's professional dignity and constituted the manifest content. The latent content, the latent themes that emerged through abstraction were contextualized to the data and surmised on the basis of reflective reasoning among the research group. Please, next one. So this is a table, a figure that summarizes, you know, the different themes that emerged in our study. The first theme is linked to intrinsic dignity of persons, and you can see it as the first theme at the top of the page. And then there is this professional inter relationships and teamwork, but also nursing professionalism as the third theme. Ethical dilemmas, because in a particular setting as palliative care, nurses told us that the ethical dilemmas were cropping up, coming out very frequently. And the last theme was linked to relationships with patients and their meaningful persons. Please, next one. So the findings, I have already underlined the 5 main overarching things that were identified. And, you know, these things, you know, describe the significant features of this concept, nursing professional dignity in palliative care. Please, next one. So, what to focus on each theme, but after this slide, we are having a figure that can summarize and visualize graphically the different themes and how they are interweaved and interlinked together. So this study provided insights into understanding this concept in palliative care, nursing professional dignity, we are talking about, and enabled basic beliefs about it to be described. This concept, this construct examined was deeply embedded in the ontological concept of being a person, connected with the very essence of humanity, which is where the basis of dignity for every individual resides. Concerning the other part of dignity, so the dignity that is linked to our social life, so to our social environmental life, great importance was given in our study to the palliative care settings and on nurses' workplaces experiences. Nurses interviewed claimed that were more respected than in hospitals. And this is a particular outcome that should be bear in mind, because, you know, when we are talking about the job satisfaction, nursing job satisfaction, it's important now to know, also with other literature to support these findings, that to work in a community setting sometimes for nurses is more rewarding because of different factors that I'm going to explain in the next slides. And one of these factors that's very important, and maybe is the more important factor for nurses and other health professionals to be respected as professionals in that particular setting, is to have mutual respectful relationships among them. And this is not always the case, because we have had other studies in this on this concept in hospitals, for example, in hospitals in Italy, in hospitals in the UK, and you know, generally, broadly speaking, nurses weren't so satisfied for some, you know, variables that were linked to the particular environment of the hospitals. Here, in palliative care, that constitutes an epiphenomenon of the community setting, you know, they describe, the majority of them describe that their satisfaction to operate in palliative care was more than when they were working in healthcare facilities. So please, next one. So teamwork enhanced dignity when nurses reporting being listened to and trusted as an equal. The relations with patients and their family were based on a common respect. And I'm talking about this particular setting, palliative care, even if sometimes, especially at the beginning of these interactions, were present some incomprehensions with families who hardly accepted the mental illness of their loved ones. Many ethical dilemmas were lived by nurses, especially regarding the overtreatment of patients or the ambiguity to communicate their state of health. I mean, the state of health of these patients, because, you know, sometimes there is this red thin line to communicate with the relatives of patients the exact diagnosis, a major diagnosis of the poor patients who are treated in palliative care. So, and this study shows that the effective interprofessional relationships are essential to have a good quality care. Please, next one. So this was the figure that I was talking about. And as you see, there is an intrinsic dignity of persons, and this dignity is linked to each one of us. Each one of us, regarding if you are working as a doctor, as a nurse, or you are unemployed, you've got a dignity just for the reason to be a person. And all nurses interviewed recognize this intrinsic embedded dignity that is very ingrained in the essence of a person. Then there is the social dignity that constitutes, you know, the inner circle of this figure that in our case is linked to palliative care, and it's constituted by relationships with patients and their meaningful persons, nursing professionalism, ethical dilemmas, professional interrelationships, and people. Please, next one. And next one is the last one, so I can respect the times. What this paper contributes to the wider global clinical community. You can, if you are interested, you can read the paper on Journal of Clinical Nursing. But the concept of nursing professional dignity is complex and widely underexplored. It has to be in-depth analyzed in the different socioeconomic and political patterns of evolution of the nursing profession in different geographical regions. With this study, for the first time, the research team has shed light on this topic in community settings. Now we are going to be publishing a particular study on community settings in a northern country of Europe. And so, you know, I don't want to anticipate anything, but the results confirm the results of this study. And these studies, this is very important, show that nurses perceived to be more respected in their inner dignity as persons in palliative care settings compared, you know, to healthcare facilities. Broadly speaking, not all of them, but the majority of them, because, you know, one important factor not to be respected is to have relationships with other health professionals. And you guess who are these health professionals who sometimes a little bit more often disregard the dignity of nurses. Unfortunately, these are doctors, and doctors, nurses interviewed told us that in palliative care, they were treated equally on the same level as doctors, and they felt very, very respected by this recognition of their inner professionalism. So this is very important. And another, the last one, then another, you know, takeaway message is that community settings, when we are speaking about dignity for nursing and nurses, guarantee, generally speaking, a stronger sense of teamwork among the different healthcare professionals, and also professional decision-making and independence, autonomy, you know, are driving forces for retaining nurses in those environments. And you know, we have got a great problem to retain nurses in particular settings because, you know, there is a great drop out of these professionals. And our study confirms that if nurses are treated well, this is more important to have other benefits. For example, a bigger salary. You know, people need to be respected and to be valued in their inner essence of persons. Thank you very much, because the last slide is just thank you very much for everybody.